So hello बच्चों and welcome back to the clinical anatomy case discussion of lower limb. चलो तो पार्ट 4 की तरफ चलते हैं. आई एम क्लियर द प्रीवियस क्लिनिकल केसेस आर क्लियर टू यू. हमने ग्लूटियल रीजन के बारे में बहुत डिस्कस किया है in details the various clinical cases and I'm sure you must have understood it. So coming to a different region now, चलो आगे की तरफ चलते हैं, है ना, आगे की तरफ. Have a look at this. So 23 years old woman has a deep laceration. Laceration मतलब इंजरी होती है, हाँ, wound होता है, wound. A laceration is a wound, a deep wound just below the midpoint of inguinal ligament. Midpoint of inguinal ligament. Midpoint of inguinal ligament. Any guesses? Midpoint of inguinal ligament or the mid inguinal point actually होना चाहिए था. Mid inguinal point पे एक artery हम palpate करते हैं, feel करते हैं. What is that artery? That's the femoral artery. That's a mid inguinal point. हाँ, यहाँ पे midpoint of inguinal ligament दिया, but ठीक है, you should be able to understand and judge. Sometimes the question may be slightly different, but आपको वो समझना है. With brisk bleeding दिया, हाँ, so you should be able to understand this. So deep laceration just below the midpoint of the inguinal ligament. एक चीज क्लियर करते हैं, what is midpoint of inguinal ligament and what is mid inguinal point. ये दो चीजें पहले क्लियर कर लेते हैं, so it will be clear to you. Look at this. यह है anterior superior iliac spine, यह है pubic symphysis, ठीक है, that's the anterior superior iliac spine. This is the obturator foramen. Fine. What is this? Pubic tubercle. हाँ, ये pubic tubercle है. Fine. So anterior superior iliac spine. यह है anterior superior iliac spine. Anterior superior iliac spine से pubic tubercle तक. What is this? What is this? Anterior superior iliac spine to the pubic tubercle. That's the inguinal ligament. Inguinal ligament. Anterior superior iliac spine to the pubic tubercle. That's the inguinal ligament. इसका midpoint. इसका midpoint. इसका midpoint is the midpoint of inguinal ligament. Midpoint of inguinal ligament. समझ में आ रहा है? Anterior superior iliac spine to the pubic tubercle. उसका midpoint is the midpoint of inguinal ligament. And anterior superior iliac spine to the pubic symphysis. Anterior superior iliac spine to the pubic symphysis. इसका midpoint. This is the mid-inguinal point. Mid-inguinal point. Fine, that's a mid-inguinal point. So what is mid-inguinal point? And this is pubic symphysis. हाँ, मैं यहाँ पे लिखता हूँ pubic symphysis. So that's a pubic symphysis, and this is the anterior superior iliac spine. So anterior superior iliac spine to the pubic symphysis. This is the उसका midpoint. That's a mid-inguinal point. क्लियर बच्चों, दिस मिड इंग्वाइनल पॉइंट एंड मिड पॉइंट ऑफ इंग्वाइनल लिगामेंट, ये दो अलग अलग चीजें हैं. इज दिस क्लियर टू ऑल ऑफ यू? सो एट द मिड इंग्वाइनल पॉइंट जनरली वी फील द फीमोरल आर्टरी. यहाँ पे अगर अपन पैल्पेट करते हैं तो वी फील द फीमोरल आर्टरी. हाँ, ठीक है, बट क्वेश्चन में थोड़ा सा वेरिएशन हो सकता है. यू शुड बी एबल टू फॉलो दैट. फाइन. सो midpoint of inguinal ligament दिया, that's fine, but that's fine. So with brisk bleeding, एकदम झट से blood आने लग गया, that means which is the vessel injured? That's a femoral artery. Femoral artery. Fine. And this femoral artery is a continuation of what? Anyone? This femoral artery is a continuation of external iliac. मतलब we have got this external iliac artery. External iliac. Okay. External iliac continues as femoral artery. External iliac continues as femoral artery below the inguinal ligament. Inguinal ligament के नीचे, below the inguinal ligament. So external iliac continues as femoral below the inguinal ligament. ये clear है बच्चों? Is this clear to all of you? चलो, तो mid point of inguinal ligament, mid inguinal point is clear to all of you. Fine. So which triangle is this and list its boundaries? ये अपन थोड़ी देर के बाद देखते हैं. List the key contents. Which vessel is most likely to be injured? Okay, fine. So which triangle is this? Anyone? Can anyone guess this? कौन सा triangle है जिसमें अपन femoral artery को feel करते हैं, palpate करते हैं? Which is that triangle? That's a femoral triangle. इसके boundaries बोल सकते हो. That's the inguinal ligament. ये कौन सा muscle है and what is this muscle? So this is the inguinal ligament. इंग्वाइनल लिगामेंट, ये मीडियल साइड है, ये लैटरल साइड है, laterally is the sartorius, medially is the adductor longus. So this becomes a femoral triangle. So medially adductor longus, laterally is the sartorius, the base is formed by inguinal ligament. Fine. इसके अंदर देयर इज अ शीथ हियर, यहाँ पे एक शीथ होती है जिसका नाम है femoral sheath. हाँ, यहाँ पे femoral sheath होती है. We'll see this in some other clinical case discussion. ये femoral sheath होती है. Femoral sheath के 3 compartments होते हैं. There are 3 compartments for femoral sheath. In the lateral compartment, that's the femoral artery plus एक nerve होती है, the femoral branch of genitofemoral nerve. So femoral sheath के lateral compartment में होता है femoral artery and the femoral branch of genitofemoral nerve. The intermediate compartment में क्या होता है? Intermediate compartment is the femoral vein, and the medial compartment is known as the femoral canal. हाँ, medial compartment empty होता है, खाली होता है. That's known as the femoral canal. So femoral triangle clear है. How is it formed? Clear है. What is present in the femoral triangle? एक femoral sheath होता है. And femoral sheath के 3 compartments होते हैं. Laterally is the femoral artery and the femoral branch of genitofemoral nerve. In the intermediate compartment is the femoral vein and the medial compartment खाली होता है. That's the femoral canal. Fine. अब जो femoral nerve होती है, femoral nerve is not a content of the femoral sheath. Femoral nerve बाहर होती है. It's outside. Femoral nerve is outside the femoral sheath. It is not a content of a femoral sheath. Perfect है बच्चों. Femoral sheath में कौन है? Femoral artery, femoral vein है, with the femoral branch of genitofemoral nerve. Clear? So who's not there in the femoral sheath? The femoral nerve. It is outside the femoral sheath. Outside. चलो देखते हैं ये. ये clear है ना? Deep laceration injury हो गया. So which triangle is this? That's a femoral triangle. ये first sub question is clear. Femoral triangle boundary is clear है. Sartorius, adductor longus, inguinal ligament. List the key contents medial to lateral. So medial to lateral क्या होता है? Medial to lateral is the femoral vein. It's the medial to lateral. कैसे लिखोगे इसको? Femoral vein, femoral artery, femoral nerve. That's a femoral vein, femoral artery, and the femoral nerve. See this. कहाँ गया? Sorry. Look at this. So femoral vein, ये पहला femoral canal आएगा. Femoral vein, femoral artery, and सबसे बाहर is the femoral nerve. So अगर आपको femoral canal भी लिखना है तो you can write femoral canal. So femoral canal, femoral vein, femoral artery, and सबसे बाहर is femoral nerve. Which vessel is likely to be injured? That's a femoral artery. Femoral artery. बस ऐसे लिखना है. Name one structure that is not in the femoral sheath but is at risk. So what is that? Femoral nerve. बच्चे, I hope you are getting an idea. So where are we? हम कहाँ हैं? Femoral triangle में है. Inguinal ligament के नीचे एक wound हो गया, laceration हो गया. So who's involved in that? The femoral sheath. अब femoral sheath के contents क्या है? सबसे medial is the femoral canal which is empty. फिर femoral vein, फिर femoral artery, and the most lateral is the femoral nerve. इसमें से the femoral artery and vein is in the femoral sheath. The femoral nerve is outside the femoral sheath. I hope this is clear to all of you बच्चों. हाँ, for details of the topic आप lecture जरूर देखना. एक बार lecture भी देख लो. So once you see the lecture, you get an overall orientation. उसके बाद the clinical cases will be easy to understand because your concept is clear. ठीक है? I hope all these things are clear to all of you. So एक MCQ आपके लिए वापस as promised. So which structure is not enclosed within the femoral sheath? Answer this. Answer the MCQ in the comment box. बस एक चीज बोलता हूँ आपको, नहीं तो you'll be confused. ये जो femoral canal है ना, the upper part of femoral canal, ये जो upper part है femoral canal का, हाँ, upper part, इसको बोलते हैं femoral ring. And on this femoral ring, यहाँ पे एक lymph node होता है, which is known as the lymph node of Cloquet. ठीक है, lymph node of Cloquet. So femoral canal का upper boundary is known as the femoral ring. Femoral ring is closed by a lymph node जिसका नाम है lymph node of Cloquet. So lymph node of Cloquet is also a content of femoral sheath. Femoral sheath में आ गया ये, ऐसे सोच सकते हो. ठीक है. So I hope this MCQ, this clinical case discussion is clear to all of you बच्चों. Thank you so much once again and देखते रहिए clinical anatomy case discussion series of lower limb. आप जरूर confident होंगे. Let me know in the comment box if there are any queries or anything that you've not understood. See you once again in the next clinical case discussion. Thank you.